Hello and welcome, my friends. I'm Dr.Saptarshi Banerjea, coming to you at a time when the world is recovering from COVID-19. Very many people, very many patients you'll come across have had COVID, diagnosed or perhaps undiagnosed, but they're still suffering from the lingering effects of COVID. In this world, homeopathy has a very good answer to those lingering after effects of COVID-19, which the medical fraternity is calling as post-COVID-19 syndrome or long COVID. Myself in the Indian subcontinent, my father in the United Kingdom, as well as across the globe, have been treating patients who are recovering from COVID-19. As you understand, the COVID peak has been different times in different parts of the world. Hence, we have been handling post-COVID-19 syndromes or long COVID throughout the year over the last 1 year since COVID started. Some of the common ailments which are coming up post-COVID is weakness, fatigue, fibromyalgia, tinnitus, loss of smell and taste or alteration of smell and taste, insomnia, depression, apathy, anxiety, panic attacks, cardiac weakness. So these are the common features which are coming up in post-COVID-19 patients or patients of long COVID. I'll be sharing with you remedies, practical remedies which we have been using to help these patients on their path to recovery, so that they do not suffer from the lingering after effects of COVID-19. Again, my friends, this is a two-part series where I'll be sharing with you some of the commonest remedies which I've been using in this post-COVID-19 recovery world. And I'm sure these remedies will come to your rescue wherever in any part of the globe where you reside. I'll be sharing with you again remedies, again in no particular order, which we have been using, and trying to share with you as well the innate comparative metromedica, so that you can implement those remedies in the real world. My number one in this list, my friends, is Sorainum. If you think of a remedy like Sorainum, there's a lot of weakness, low appetite, especially after recovery from an acute illness. If you think of cases of COVID where they had a diarrhea, so there was a loss of vital fluid, and Sorainum can help in those aspects as well, where there was a loss of vital fluids as well. So in those conditions where you have weakness, you have loss of appetite, post an acute illness, especially COVID in today's world, along with that there is the chilliness, which is an important factor of Sorainum. Along with that, there's hopelessness, there's despair of recovery. Will I ever recover? Will my lingering COVID symptoms ever go away? So there's always that hopelessness and pessimism in Sorainum, which is quite pertinent in today's world. All of these remedies which I'm sharing with you, my friends, are useful for post-COVID-19, not because their symptoms match, but on one hand you have etiology, where there's an after effects of an acute illness, where there's an exhausting effects of an acute illness, resulting in these group of symptoms. So you're putting in perspective etiology on one hand, the manifestation on the other hand. So in that way, these remedies are more apt and effective because they are covering the etiology of an acute illness, of an acute flu or an acute infection. Obviously, I've broken them down to zincum. Any remedy can be useful in patients recovering from COVID-19. But here I'm trying to share with you remedies which have an etiology as well as a manifestation to take care. So Sorainum will have the weakness, will have the loss of appetite, especially after loss of fluids or after an acute illness. Along with that, the chilliness. You know, Sorainum is the chilliest medicine in the metromedica. The chilliness along with hopelessness, and there's the despair of recovery, which is very important for Sorainum. Sometimes the vitality is low, so 30C is always apt to start with. You can go up to 200C. My second medicine, my friends, in this list is Natrum ars, Natrum arsenicosum. Again, if you see in Borica's Metromedica, there is a line, often facilitates the termination of the cold and conserves the strength and appetite. So it will help in terminating the cold. It will conserve the strength, it will conserve the appetite. Now you'll be thinking it is similar to Sorainum. Yes, it is, with the loss of appetite, with the loss of strength. But again, you have to put in perspective. Sorainum will be very, very chilly on one hand, but Natrum ars is a combination of Natrum and arsenicum. One is hot, one is chilly, so you can have either in Natrum ars. Secondly, if you think of Sorainum, you have the hopelessness, you have the pessimism. Whereas in Natrum ars, as a consequence of seeing some near and dear ones hospitalized or being fatal, you'll see either the anxiety of arsenicum in Natrum ars, or you'll see there is a retention and solitude desire of natrum in Natramars. But Natramars is wonderfully effective in today's world, where you have loss of strength, where you have loss of appetite, and there's lingering cold symptoms, and Natramars will take care of that in a patient who's having either the anxiety of arsenicum or there's a retention and brooding of natrum. 30C, 200C again is very effective Natramars. Sometimes with Natramars, it is a remedy for minor's asthma, but obviously for COVID-19 patients, you'll find a certain degree of oppression in the chest, again, which you'll not find with Sorainum. But Natramars, if you see in Borica's Metromedica or any other Metromedica, you'll find it mentions about the oppression in the chest, which is quite important. My third medicine, my friends, in this list is another arsenicum, is Chininamars, Chininum arsenicosum. Again, my friends, Chininamars is a remedy which will help you as a general tonic. It helps you with the weakness after an acute infection. If you look in Borica's Metromedica, there's a specific line, circulatory weakness after an acute infection. And that's very, very specific and apt for post-COVID-19 patients. The circulatory weakness, the weakness in circulation, the slowness in circulation, what is that causing? There is that always shortness of breath. Post-COVID-19 patients who have had lung infections will complain to you that I feel shortness of breath, I'm out of breath, and especially on ascending the stairs. You'll find Chininamars be very effective where you have shortness of breath while I'm ascending the stairs. That's very important. How to differentiate with other remedies? In Chininamars, patient is also better by bending forward, like arsenicum. But the difference of Chininamars and arsenicum is they want to be bending forward in front of an open window. You know, arsenicum is chilly, so she doesn't want that. But in case of Chininamars, they want to be bent forward in front of an open window. So although you have the arsenicum component, but Chininamars is strongly better in fresh open air. So they need fresh open air, and especially with the shortness of breath, they're feeling better by bending forward because that's the arsenic component, but they're also better in fresh open air. That's important. The circulatory weakness is very, very classical for Chininamars, especially for patients who have had a post-COVID-19 pneumonia. They're recovering, they're out of breath, they want open air, but at the same time they're bending forward. That differentiates Chininamars from arsenicum album, which is very important. And obviously you have the arsenicum component, so there's a weakness always persistent in case of Chininamars. 30C, 200C, again, very good choice of potency for Chininamars. My fourth medicine, my friends, in this list, again, a very common complaint in today's world of post-COVID-19 recovery is cardiac irritability. So think of cases where you had COVID and after that you're having anxiety, you're having panic attacks, you're having a lot of palpitation along with that. And my friends, the top remedy for that is Scutelleria, 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 Scutelleria laterifolia. It's in Boricae and Clark's dictionary. Very many of my friends have been prescribing aconite as well. I understand aconite is more with the fear of death, with that kind of panic attack and anxiety. But here in case of Scutelleria, it's just the anxiety and panic attack which is coming up post-COVID. If you see in Boricae, it's mentioned that there is cardiac irritability after influenza. And that cardiac irritability is the palpitation. That's important for your Scutelleria. Along with that, it's a nervous sedative. So insomnia post-COVID-19, with the anxiety, with the panic attack, it's a nervous sedative. So it will help to bring in sleep. You see in the sleep section, and I've had patients where you're having night terrors post-COVID. You're suffering from like a post-traumatic stress disorder, with a lot of night terrors, with a lot of nightly restlessness. You're having insomnia, not being able to sleep. And that augurs very well for your Scutelleria. So if you make a triangle for Scutelleria, on top of the triangle, nervous sedative, insomnia. Second side of the triangle, you have the cardiac irritability, where you're having palpitation with the anxiety and the panic attacks. And on the third side, you're finding there is that nightly restlessness, which is important, especially in patients who are having sexual debility as well post-COVID-19. There is impotency, there is spermaturia post-COVID. Again, it's mostly related with the emotional frame of mind, where they're really anxious, where they're real panicky. And that's very, very classical for Scutelleria laterifolia. 6C, 30C, 200C works really, really well. So sleep is affected, palpitation is affected, there's a lot of restlessness, along with impotency, spermaturia, where the sexual weakness is quite prominent. And there is a factor in Scutelleria where the patient feels, I won't get better anymore. with the anxiety. So anxiety on one hand, with the feeling of not getting better, with the palpitation, and with the insomnia. It's a nervous sedative, specially adapted in cases for cardiac irritability post-influenza. Here the cardiac irritability is the anxiety which is important, is the palpitation which is important. My next remedy, my friends, in this list, I think I gave you Sorinum, I gave you Natramars, I gave you Scutularia, I gave you Chininamars. My fifth medicine in this list, again, patients are coming to you with shortness of breath post-COVID-19, is Lobelia syphilitica or Lobelia caerulea. Lobelia syphilitica is a remedy you'll find in Boricades Metromedica in the relationship of Lobelia inflata or in Clark's dictionary. Lobelia syphilitica is a fantastic remedy, especially in post-COVID-19, where patients are complaining to you of oppression of chest as if the air is not reaching deep into the lungs. Again, patients who had a massive lung infection during COVID, now they're in the recovery phase, they feel oppression, they feel I'm not being able to breathe deep. The air is not going deep into my lungs, and that is very, very classical for post-COVID-19 patients. Along with that, there is always an oppressed feeling in the left part of the chest that is quite important for Lobelia syphilitica. But it's also important, along with this respiratory complaint where they feel the air is not going deep into the lungs, there's also a factor in Lobelia caerulea syphilitica that the brain is affected. There's a brain weakness. They cannot concentrate. The exertion of mind is intolerable. It's like I'm going crazy. My brain is going wild. That feature you'll find also in Lobelia syphilitica. Also, they feel depressed. There's unhappiness post-COVID-19 as well. So your Lobelia syphilitica will not only address the emotional but also the physical plane as well, where you're feeling oppression, air is not going deep into the lungs, especially my left chest. At the same time, I feel my brain is weak. I'm not being able to exert my mind. I'm not being able to apply my mind. Exertion of mind is intolerable and I feel my brain is going crazy. And at the same time, I feel very unhappy. And that will differentiate with you from Chininamars, where Chininamars is more when ascending, I feel shortness of breath and I feel better in open air. I feel better by bending forward. Whereas in Lobelia syphilitica, you don't have those modalities as such to differentiate. 6C, 30C, 200C is a very useful prescription in today's world for post-COVID-19 patients who have just recovered from COVID pneumonia. If you recall, I shared with you in COVID pneumonia, you have natrum salt where there's a constant desire to take deep breaths, but that is more in the active stage of COVID-19. Think of patients who have prescribed natrum salt during COVID and they have recovered, but they still tell you, my air is not going deep into my lungs. I feel an oppression, especially around my left chest. If you recall, natrum salt was also left-sided. Lobelia syphilitica will come to your rescue, especially with the unhappiness, especially where there's a brain weakness lingering on. 630, 200, you can help with Lobelia syphilitica, my friends. My next medicine in this list, again, doing the comparative Metromedica, is another remedy for respiratory complaints post-COVID, where you have Pix liquida, P-I-X, Pix liquida is a remedy for cough remaining after flu, cough remaining after COVID. You had COVID-19, you have prescribed different cough remedies, taken care, but there's still a lingering cough remaining on. You don't have any modalities to prescribe. What do you do? Try Pix liquida. If you look in the Metromedicas, you'll find many other remedies, creosote, iriodiction, calibic, which are remedies for cough post-influenza. But my friends, I've had very good success with Pix liquida for cough post-COVID-19. Especially when there's that oppressed feeling at the left chest. And the sputum, if there is any sputum coming up, is more like a pussy sputum, like a mucopurulent sputum, which is coming up. But even if you are devoid of these symptoms, there's a lingering cough which is remaining post-flu, post-COVID, do always think of Pix liquida. 30C works best. 30C is the only potency which really works for Pix liquida. Again, the difference with Lobelia syphilitica, Lobelia has also got an oppression in the left chest, but there's not much cough in Lobelia syphilitica. Lobelia is more like the dyspnea is unable to take in the air. The air is not going deep into the lungs. But in case of Pix liquida, there is a cough which is lingering on without any modalities. If you have tried your Brineia, Spongia, all other respiratory remedies, but still not helping, give a last try to Pix liquida. 30C works best for Pix. My next medicine, my friends, in this list, you'll find very commonly patients coming to you with loss of smell and taste post-COVID. I've tried Justitia adatoda. I shared this with you in another session. Justitia is really useful for cough with loss of smell and taste, but Justitia is not in my list because it was more in an acute phase of COVID-19. But patients have recovered from COVID-19. Still, there is a lingering loss of smell and taste. do think of Magnesia muriatica. Magmure, you'll find specifically mentioned Boric acid dictionary, Boric acid metromedica, where you have keter is followed by loss of smell and taste, and that's a specific affinity for Magnesia muriatica. Along with that, if patient is constipated, that works wonderfully, but even if you do not have the constipation, you can go ahead with Magmure in 30C and 200C for loss of smell and taste following COVID. Again, coming on those terms, you will find another remedy which is very useful is carbolic acid, where you have alteration of smell and taste. Specifically in carbolic acid, do remember there is acuteness of smell. Even if something is at a very far distance, they can smell it. It's almost like they have an olfactory sensibility, olfactory increased sensibility, and that is very classical for carbolic acid. Again, 30C, 200C works well for carbolic acid. So loss of smell and taste is more Magmure, whereas increased olfactory sensibility, you are smelling it more, that's carbolic acid. And obviously, because it's an acid, you'll have a lot of weakness in carbolic acid as well, which is quite prominent. 200C 1M, I'll say, works well because it's more on the neurological special senses plane. Carbolic acid works well with the higher potencies, and that's very classical. I gave you Sorinum, I gave you Natrum ars, I gave you Scutularia, I gave you Pix, I gave you Lobelia syphilitica, I gave you Chininum ars, I gave you carbolic acid, I gave you Magmure, I gave you 8 remedies, my friends. I'll finish this first part with 2 more. Other fantastic remedy in this list. Think of patients who have had COVID-19 pneumonia and now they are recovering from COVID-19 pneumonia. Especially where you find patients where they are having some cardiac discomfort, could be ectopic beats, could be arrhythmias post-COVID, or they're having some neurological twitching like chorea or muscle twitching post-COVID-19 recovery. Pneumococcine is a fantastic remedy, especially for patients who have recovered from COVID pneumonia. I repeat, for heart affection and for those who have got neurological affection, especially post-COVID-19 pneumonia. Tyler mentions this in her pointers to remedies, where patients have recovered from pneumonia, heart and nerves are affected. Pneumococcine works really well. And I've used it in few patients who have had arrhythmias post-COVID-19 recovery, especially COVID-19 pneumonia recovery, and pneumococcine works well in those conditions as well. My number 10 to round up this list, my friends, is one of the commonest remedies to be used in this condition is Carbo vegetabilis. Carbo veg is obviously a go-to remedy because again you have the etiology, exhausting effects of some previous illness, exhausting effects of COVID-19 resulting in respiratory to be affected. What if respiratory is affected? I'm better by fanning. What if gastric is affected? There's slow digestion, there is weak digestion, I'm better by eructation. So number 1, loss of vital fluids again is important. So a patient with COVID-19, a lot of diarrhea and now recovering, you can use Carbo vegetabilis. Exhausting effects from some previous illness resulting in respiratory affection, better by fanning, resulting in gastric affection, better by eructation as well. So I gave you 10 remedies with good comparative differences. I'll be coming up to you again with my second part, where I'll be sharing with you the few more remedies to wrap it up. Thank you very much for your kind attention. Long live Hanuman, long live homeopathy.